Good afternoon, people. This is Rickredalen, the Maverick Doctor. Some people ask me how I ever got called the Maverick Doctor. A number of years ago, when I was butting heads against medical committees, an attorney friend of mine asked me, he said, "Rick, why can't you just get along with everybody like I do? Why can't you? Do you really have to steamroll every doctor that you confront or that confronts you?" And I said, yeah, most likely I need people to do things right, and that is not done much anymore in medicine. In Dubuque, Iowa, where I practiced, I had the very largest practice. There was another doctor in town that came close to me. I was carrying a patient load of 6,000 patients. The population of Dubuque, Iowa at the time was about 60,000. They had another probably 150, 200 doctors that got to take care of the other 54,000. But I caused a lot of problems just because I took care of so many people. One of the other things I did was I took care of many elderly people, and I took care of many Medicaid people. I used to deliver the babies of Medicaid, and I'd get called in front of an obstetrics committee and say, "Why are you taking care of high-risk patients?" I know I mentioned this before. And I would say, "What's high risk?" The risk to your paycheck. You don't want Medicaid patients because it doesn't fill your billfold up enough. I wasn't nice when answering some of those questions. I didn't feel that I should be. I think doctors all have to do their part of taking the elderly, care of the elderly and the poor. When I go up to Minnesota, they still see all the Medicaid patients and they still see the Medicare patients. What do you suppose is different in Texas here? Why don't doctors want to take care of Medicare and Medicaid patients? Do you suppose our government's paying them less down here in Texas? I don't think so. I think what happens is the doctors working for all these gigantic bean counters figure down here in Texas, they're not going to let their doctors be doing something that doesn't turn a good profit for them. If we keep on looking at medicine this way, what's going to happen one of these days is a person with the average income is not going to be seen because they can't pay the great big high premiums and deductibles that the wealthy get. Don't know how that'll work. I'm going to ask you one more time, what do you suppose changed in the United States that we go from number one in the world to last in the world? What's changed? How do we go from a country that only has physical examination and a simple x-ray taking care of people and be number one in the world to have all the high technology we've got now and be last in the world? Once again, I'm going to tell you, specialists cannot connect the dots. You people out there think you're getting the best care in the world from specialists, you might want to think again. For one thing, did you get the right specialist? How do you know that specialist can take care of you? I saw a neurosurgeon in Fort Worth a while ago, and he wanted to do an MRI on me because of a neck problem. And I said, "I can't have an MRI, I've got a pacemaker." And probably 5 minutes later, he leads me into to his nurse, and he says, "Can you get him scheduled for an MRI?" And I said, "Doctor, I'm got a pacemaker, and I can't have an MRI." And it wasn't 5 minutes later, he ordered one again, and I kept looking to see if he was using drugs, if his pupils were constricted or dilated or whatever, but couldn't. But that's the kind of care you get sometimes from a specialist, so single-minded that they can't keep it in their mind for 5 minutes that a certain patient can't have an MRI, and they're going to go on about their routine regardless. I think all of you, when you're choosing a physician, go to a family practitioner. If you're being seen at Baylor, Southwestern, or one of the big groups, if you're happy with your family practitioner, write them letters afterwards complimenting the doctor you saw. Tell them that you think that doctor should be paid as well as the highest paid specialists they have. Maybe I'm slanting things a little too far one way or the other, but the more family practitioners we get rid of, the lower our health care is going to be when it comes to outcomes. Again, I think it's important that all of us play a role in trying to get to the proper level of care. It's always great to see a primary care physician for your first stop. The average ankle, average broken bone, average sprained ankle or broken bone, those don't take specialists. We can train a high school student how to do a lot of that stuff in about a half an hour. Of course, doctors are never going to let that happen because they cut them out of a paycheck. And believe me, I'm sure a good many specialists out there would rather be doing less primary care, but if there's not enough specialty work for you to do, you got to do primary care to make ends meet. I hope all of you will start writing to your congressional leaders, trying to get them to take action so that once again the United States can be the greatest country in the world for receiving care. Support your doctors, support your nurses. They're as bright as any other people in the world here in the United States, but anymore they're not taught how to use that intellect, and they're not trained to do family practice, or they know they can't make it paying off school debts on a family practice income, so they're forced to go into a specialty, and you're forced to seek second-rate care by a bunch of specialists that can't connect the dots. They're all still good doctors, but they're not good for looking at the big picture. God bless you. Have a good day.